Hello, lovely. I'm Dr. Nicola. How are you? I'm good, thanks. What brings you here today? Okay. Alright. Oh, okay. And how long's this been going on? Alright. Okay. So, you're having trouble sleeping, always exhausted, you've got aches and pains everywhere, okay, and you keep forgetting things. Alright, now I will get you to elaborate on that a little bit later. What I want to do first is just carry out a few checks, if that's alright, and then I can go a little bit deeper into the questions. Alright. Okay, so I'm just going to start by observing you, alright, my lovely? Okay. You do look quite tired, my love. You look tired and you look drained. Posture is quite slump. Okay. You just look quite down. Yeah, I'd say that, down. You look very, very tired and quite pale. Okay. You just slowly just turn your upper body that way. Back and that way. Seems like it's a lot of effort, my lovely. Is that what it feels like? Yeah. And did you have a bit of pain? Yeah. Okay. Okay. Now, would you mind just standing up for me? Okay. Sit back down. Thank you. It's definitely something going on. I can tell you're not quite there, if that makes sense. You're here, but you're not. Is that how you feel? Okay. Right. Let's do some basic checks now. So let's see if you've got a fever. Okay. I'm going to pop it on your forehead. Okay. Can I pop it in your ears? Thank you. Let's move your hair. There we go. Other side. Let's move your hair. There we go. Temperature is perfectly normal, my love. Alright. Okay. Now can I check your pulse? Okay, can I have an index finger? Okay, I'll take that one. Okay. There we go. Pulse is lovely. It's nice. Oxygen levels are great. Brilliant. Thank you. Okay, lovely. Now, have you had any anxiety at all? Any heart palpitations? What about breathlessness? What about going up and down the stairs or exercising? Okay. So, racing heart and some anxiety. Do you normally have anxiety, or is that new for you? Okay. So, okay, I'm just going to check your pulse in your wrist, okay? Okay, wonderful. Sounds good. How's your circulation been? Been all right? Okay, that's fine. Have you had any fevers or chills or any sweats or anything like that? Okay, so night sweats. Okay, can you just explain that to me? Okay. Right. Okay, so you sleep with a fan on and you're waking up quite drenched. Everywhere or mainly upper body? Okay. Okay, and okay, so it can be that severe that everything is soaked. And the linen as well, bed linen. Okay. Is that every night? Most nights, okay. Does it just happen the once, or are you waking up multiple times and sweating like that? Okay, so it depends. Okay, so what medication are you on? All right. Could cause some sweating, but how long have you been on that? Okay, possibly not now if it's only recently started. Okay. All right. So you've had no chills or fevers as such, but you're having these night sweats. Okay. What about sweating throughout the day? And does that feel like you maybe have a cold or a flu or... Yeah? And what are you doing at that time? Anything in particular? All right. Let's check your blood pressure. Okay, if I can have your arm. Thank you. Pop it just in there. Like so. Okay, relax your arm down. Let's check your pulse. check it once more. Wonderful. Blood pressure's fine, my love. Okay. So, do you have any headaches, any dizziness? Okay, what about fainting? Okay. And when I took your blood pressure, did you feel dizzy or faint? Good. Okay, so you do get some headaches. How often? Okay. Thank you. Right, so I'm going to have a look in your eyes. Okay, look straight ahead. It'll be bright. Pupils are fine. Now I'm just going to have a look in your eyes. Okay. Your eyes are very watery, very bloodshot. Typical tired eyes. I'm just going to get my other light. And this is bright, okay? Oh yeah. See the dark circles? And in the eyes, quite red, tired looking. Okay, now if you could just pull down your eyes. Maybe a little bit of dry eyes. Okay. Relax. Great. So your under eyes, definitely tired. You have some dry eyes. Now you are very alert, okay? Now your pupil size is perfect, retracting as it should, okay? And the shape's fine, and so is your eye shape, alright. Now, do you get any itching, any blurred vision, and difficulty focusing? Okay. When did you have your last optician appointment? Okay. That's fine. Okay, good. Just gonna look at your lips. Quite cracked and quite dry. Okay, do you find you get quite sore lips? I could have a look in your mouth, if you just open wide for me. Okay, pop out your tongue. Curl it up. And let me have a look. And just wiggle it around. Relax. So your tongue does look quite dehydrated. Alright. Do you find that you are quite thirsty a lot? Okay, at night. Okay. And are you drinking more than normal, would you say? Okay. So, have you had increased urination? Okay, and when? Okay, so you're getting up multiple times a night. Okay. And then you're struggling to get back to sleep as well. Okay. And what about in the day? Okay. That's quite a lot. And how long has this been going on for? Yeah, so it's gradual and then all of a sudden it's there. I get that. Okay. Okay, my love. Now, I don't know what your skin is like normally, but it does appear to look quite dry and dehydrated. You also look quite pale. Is that a new thing? Okay. All right. Okay. What about the rest of your body? So that's quite dry and itchy. Okay. Now, have you got any significant dry patches, or just does it all feel like dry and dehydrated? Okay. So similar to your face. Let me have a look at your arms. Let's look at your hand. They're very dry, aren't they? Yeah, I can see and feel that about this one. If you're on the knuckle area there. Dry, yeah. Okay. So you've got dry and rough texture. Definitely dehydrated. Okay. Right, let me just look at your hands, pop them out. So your hands do feel quite warm. Alright. And they're quite dry. There's no swelling. And I can't see a tremor of any sort. Okay, you can relax. And the colour does appear to be quite normal. So that's good. Now, do your hands feel colder than normal? Are they more sensitive than normal? Okay. Let me look at your nails now. Okay, they do look quite pale, a little bit rough in places, maybe a little bit peeling and splitting there. Let me just feel. Oh, they are quite weak, aren't they? Is that a new thing? Okay, so we've got pale nails, ridges, and brittleness, splitting and peeling. Okay, and how are they growing? Okay, so quite slow, but then they break off. Okay. Okay. I mean, the capillaries are filled properly, which is fine, so I'm not concerned about your circulation or anything, okay? So did you used to have nice strong nails? Okay, and it's changed. Alright. Okay, so... So your hair, let me have a look. Your brows, they're quite sparse. Have they always been that way, or? Oh, okay. So you've been losing brows, hair, and lashes, and your lashes snapped. Oh wow, when was that? Oh, interesting. That would make sense with the sparse and gaps there. And your lashes are quite small, but they're there. Okay, they've obviously snapped off, haven't they? Okay. Now, looking at your hair, it does look quite dry and quite thin. Yeah, is that normal? Okay, so you're having a lot of hair fall out, break, snap. Okay, and it does feel really quite dry and gets tangled. Okay. Yeah, oh, I can understand that. If you've gone from having nice, healthy, thicker hair to what it is now, I can understand why that's making you feel down, my lovely. All right, now I'm just going to have a little feel through your hair. Okay. Just have a feel. Have you got any bald patches anywhere? You haven't, okay. Yeah. Okay. Definitely your hair is very dry. Okay. Do you dye your hair? Okay. And how often? Okay. That shouldn't be causing that then. Okay. So do you feel too hot, too cold? Okay, what about sudden waves of heat? Okay, so are you constantly throwing off the covers, not wanting to wear a lot of clothes, and even in the cooler weather? Okay. So you get hot flushes and night sweats. And has anyone noticed the change in your temperature? Yeah. Okay. Okay. So, am I alright if I just check your sinuses and glands? Okay. Okay. Can I touch? Let me know if you do feel any pain or discomfort. Okay, let's go down there. Glands feel fine, sinuses feel fine, and so do your ears. Okay. Okay. Any problems with your lungs at all? Any breathing problems? Okay. Any wheezing or anything like that? Okay. Do you ever feel cold, dizzy, breathless? Okay. I'm just going to watch you breathe. Take a nice deep breath in. Hold it. Release. Again. Release. Chest movements look fine. Sound okay, but I will have a quick listen in a moment. Okay. Have you noticed any difficulties in your breathing? Any changes? Okay, good. So what about any chest tightness or coughing? Okay. And any pain in the chest? Okay. Good. That's reassuring. Now, your hands, I said, are obviously an okay colour, and your capillaries filled up nicely in your nails, and obviously your hands when I pressed it, so your circulation does look fine. Now, your feet, do you get cold feet a lot? Okay. So let's have a little listen to your chest, okay? Okay. Normal breathing. Okay, take a nice deep breath in. Hold it there. And out. In. Out. Good. Okay. Now that sounds lovely. Alright, heart beating as it should. It's nice and strong and healthy. Your lungs sound nice and clear. No crackling or any abnormal sound. So that is all good. Lovely. Now, tell me about your pain, please. So is your pain localized or is it all over? Okay, so you've got a lot of pain in your neck and shoulders, but then you get a lot of pains just all over and in your joints. Okay. Are you diagnosed with any issue like arthritis or anything? You're not. Okay. Okay, so you've got neck pain and your shoulders, so down like so and around your blades. Yep. Okay. Anywhere else in your back? Okay. So you've got your hips, knees, and your wrists. Okay. Can ache and just aches throughout your legs. Okay. Describe that to me. I get that. I totally understand what you're saying. So that's what we call restless legs. Yeah, it's not a nice feeling at all. It's horrible and it's hard to describe, isn't it? Yes. Oh yes, you can get it in your arms, my lovely, and even in your back. Yeah, and you get this weird sensation that you just want to just pull like your arm off or your leg off. It's a very bizarre feeling. It's not nice at all. I sympathise with that. So that's definitely restless legs, my love. Okay. Yeah, it will be worse at night. That's usually when people experience it, is night time, when your nervous system in your body is kind of calming down. Yeah. All right. It's not nice at all. Okay. Okay. Now, with your head, would you be able to just turn your head that way for me? And back. That way. Back. Down to your chest. Back. And can you go as far back as you can? And back. It's definitely quite stiff. Bit of restriction there. Have you ever had a neck injury or anything like that? Okay. I'm not going to obviously do a full body exam, but I am just going to have a little feel around. Okay. Touch your shoulders. Go around a bit. There. Okay. Okay. Bit of cracking there. And a bit of cracking there. Just feel around your knees. Maybe a bit of swelling around your knee. And if you notice that, you could have fluid on the knees, bone spurs, could have a bit of arthritis, or you could just be having edema. Okay. How are your ankles? Are they okay? Okay, let me have a look. That's okay, actually, my love. The ankle's all right. Okay, so it might be worth having a scan on your knees to see if we've got any fluid on there or any arthritis or anything like that. That could be a good starting point. All right. And I could refer you on to an orthopaedic specialist or a rheumatologist or something like that, especially if you are complaining of chronic widespread pain. All right. I think so. I mean, there could be something like, arthritis. There could be fibromyalgia or something like that. All right. So that might be kind of worth you know, see they might be able to do something for you, especially if you've got all that stiffness and things. So when you wake up in the morning, are you quite stiff, achy, tired, in pain? Okay, and what about at night? Yep. Now, how's it affecting your life? To lift things, to exercise, you know, walk, housework, what kind of things? Yeah. See, that's why I'm like, you know, there's not a single injury, it's widespread, and I feel like a referral could really help here. Yeah, I think so. I mean, I will be doing a blood test today anyway, and I will check for Lyme disease just to be on the safe side, my lovely. Okay, if that comes back clear, then we know that things are not affecting that. Okay. Now, when the pain is the worst, what would you rate it at? Okay, now does the pain often keep you awake at night? Does it wake you up? Okay, what about the day? Okay, what are you using as a pain relief? Helping? Okay. Hot water bottle, yeah, that would be really good for you. Keep using that. But you might need to have something a little bit stronger, which I'm thinking, you know, a rheumatologist will be able to do that, which would be really good. Okay. Okay, right. So, let's just have a look, see. Right. So tell me, what symptom is bothering you the most? Yeah. Okay. Remind me, when did all this begin? Okay. And has things suddenly got worse, or has it been a gradual thing? Okay. Do you feel like it's improving, stabilising, or worsening? Okay. And is it daily, intermittent, or constant? And is it affecting your home life, driving, exercise, socialising, or motivation? Okay. So with the sleep, are you struggling to get to sleep? And are you waking multiple times, even if you're not sweating? And are you waking up still tired? Okay. Right. Insomnia score, out of 10 being the worst, where would you rate it? Okay. What about fatigue? Pain? And then you mentioned the memory issue, which is what we'd call brain fog. So how would you rate that? Okay. And overall, the impact of your life. Okay. Okay. That's fine. So, got a couple of questions that I'd like to ask you. Okay. So, how is your morning energy level? Okay. Do you need a nap? Do you feel physically drained and heavy? Do you have a reduced stamina? And can you exercise, or do you find it intolerable? Okay, now what's your afternoon like? When you get up, how's it kind of, yeah, okay. Now, the brain fog, so you get in the forgetfulness, okay. Now, are you losing words? Okay, forgetting appointments? Do you have difficulty concentrating? Difficulty reading or following TV? Do you lose train of thought? And do you feel mentally overloaded? So the sleep, I've asked, difficult falling asleep, staying awake, working mornings, nights, and you've got okay, I've done that, that's fine. So definitely got temperature changes, haven't we? So we're waking up hot, sweaty, and comes off normal. What about your mood? Okay, so low mood, quite depressed, anxious. Okay. That must be really difficult for you, especially with all of this that you're dealing with. Okay. Now, any weakness or numbness or speech changes anywhere? Any unexplained weight loss? You don't. Any persistent fevers? Okay. Severe headaches? Okay, so you do have them every so often. Okay. Any blackouts? Okay. No infections or illness or anything like that. Okay, that's fine then. Okay. So I do want to go a little bit more into the brain fog, just because obviously I need to make sure that everything is okay. Alright, so I will be asking you some questions and you may think they are daft, but please, if you could just respond to them. Okay. So we've got forgetfulness, losing words, train of thought, poor concentration, mental fatigue. Okay, so is the brain fog worse than after poor sleep? Do you avoid tasks because it feels too hard? Can you confirm your name? Your date of birth? And what's the current date? And where are you? And what's the reason for the appointment? Good. Now, I'm going to say these 3 words. Apple, river, candle. Repeat them. Okay? Thank you. So, can you tell me the months of the year backwards? Good try. Days of the week backwards. Good try. Okay. Repeat 3, 4, 5. Okay. And recall those numbers backwards. Okay. I'm going to get some cards out in a moment. I'm not going to do a lot of these, but I just want you to do a few. What's that? Okay, and what do you do with it? Good job. And this, what is it? And what do you do with it? And this, what do you do with it? So what are all those things? Correct. What's that? Okay, what's it used for? Okay. What's this? What do you do with them? And what's that? What do you do with it? And what are they? That's correct. What's this? And what do they do? Okay. What's that? And what sound do they make? Okay. What's that? And what sound do they make? And what are they? Correct. What's that? And where does it go? It does. And what's this? And where does it go? And what's that? And where does it go? And they are perfect. Got no problems with that. So I don't actually feel like it's anything like dementia, my lovely. All right. No, it's not like that at all. It's definitely what we call brain fog. All right. Not as in you're totally forgetting things and things like that. Okay. Okay. So what time do you normally go to bed? Okay. And what time do you attempt to sleep? Okay. So when you're in bed, how are you feeling? Is your mind racing? Are you uncomfortable, anxious? Okay, and how many times a night are you waking? Averagely. Okay, and that's including for the toilet and sweating and just in general. Okay. And how long are you awake for each time? Okay, so it depends again. Okay, and can you go back to sleep straight away, or is it a while again? Okay. You're not getting a lot of sleep, are you, my lovely? So in the morning, are you feeling refreshed? And what's your morning energy like? Now, sleep satisfaction, 10 being amazing, where would you put it? Okay, and are you sleepy in the daytime? Okay, and do you need naps? If so, how many? Okay. So we said night sweats, they are nightly, and bedding soaked, clothes soaked, etc. And you change clothes. Okay. Hot flushes we've mentioned, and just daytimes, evenings. Especially after meals, didn't you say? Okay. Now the severity of them, 10 being the worst, where would you put that? Okay. How long do they last? Okay. Anything triggers it? Stress, washrooms, alcohol, or is it just random? Okay, my lovely, thank you very much. And you said you tend to feel too hot, don't you? You use a fan or windows open, and that you put on notices. Okay. And do you ever feel cold afterwards? Okay. So, tell me about your bedroom, your sleep environment. What's the temperature like? Yeah. Okay, and is there any light or noise? Okay. Right. Any caffeine or alcohol before bed? Okay. And do you use screens in bed? For how long? Okay. Now, let's check anything on sleep apnea, okay? Do you snore, or anyone tells you that you do? Anyone tell you that you suddenly stop breathing? Okay. Dry mouth. Okay, so you get dehydrated through the night and quite thirsty. Are you waking up with a headache? Okay. Okay. Did you bring me a urine sample? Oh, wonderful. Would you mind just popping it on the side for me? When was your last period? Okay. And what was it like? Yeah. Okay. And what about leading up to that? Yeah. Okay, so you've had 6 full months of no bleeding at all, and then about 6 months of like spotting. And you've not been to the doctors about this issue before. Okay, so that alone would show to me that you're possibly now in the menopause. And that, with all your symptoms, I would definitely say I really think you are in the menopause. Okay, before I even asked you about your periods, the symptoms are just classic menopausal symptoms, okay, and they coincide with low estrogen. All right. Yeah, I mean, you just thought you were perimenopausal, yeah, which, yeah, you probably were. I think it's gone beyond that now. And all of your symptoms are menopause related symptoms. Joint pain, aching, trouble sleeping, night sweats, brain fog, insomnia, fatigue, everything that you've described to me today fits perfectly with the menopause. All right. Yes. Now, you could be post-menopause, but because you are still experiencing a lot of symptoms, I'm just going to say that you are in the menopause. We need to confirm this with a blood test. Okay. Which I want to be testing a few different things because I want to check all your hormone levels and make sure they're okay. And I want to check some other things as well, just to make sure that everything is okay. Okay, so looks like you are in the menopause, my lovely. Okay, and you're not going crazy. All right. You're definitely, you are unwell, and it's because you're lacking that estrogen. All right. I know it's not very pleasant, and all these things that you are talking about are linked up to that. And having extremely low estrogen is, it's not very good for us, and it makes us really unwell. Okay, so I do need to check your estrogen levels and actually see where they are. I will be checking your testosterone levels as well, your binding hormones, and a couple of other things as well, just to see if we are, over that stage now and actually in full menopause or not. It will give me a reading of your levels, and then I can see that. But it's not just about the levels. So even though the levels might show that they're normal, for example, but your symptoms are real, so we need to kind of treat those as well. All right, not just looking at the numbers. Yeah, a lot of people just look at the numbers, and you need to look beyond that. Okay. No, my love, you're not necessarily too young for that. No, it can happen really at any age. Yeah, I mean, typically starts to decline quite a lot by 40. All right, but different women, some can go earlier, some can go later. Yeah, it really just depends on you and your body. But I won't know a definitive answer until I get those bloods back. All right. Yeah. And that will help. Let's check your urine now and see if there's any infection. Great stuff. I think it looks pretty normal, my love. Yeah, that's all clear. So your urine is perfectly fine. So let's take some blood. If you can go like that for me. Okay. What do you like with blood? Okay, any arm usually better than the other? Okay, let's have a feel. Does it hold your fist? We do. Wonderful. Keep your fist like that for me. Okay. I'm going to be taking 3 bottles today. And we need a form, don't we? Okay, so look out and total. So check the Lyme disease. Okay, that's quite a lot that I want to check, my love, okay? Okay. Sharp scratch. Okay, release. Doing really well. Good job. Okay, can you hold that down for me? Thank you. Right. Keep pressing on that for me, my love. Okay. Ready? Let me have a look. Okay, wonderful. Okay, that's perfect. So they should be back in a couple of days. All right. Then we can see actually what's going on. All right. To me, there's definitely a menopause issue here. All right, especially with the lack of periods and the symptoms. Okay, so we could look at some HRT once your bloods are back. Okay, you know, and you may need some testosterone as well. Okay, we could give something to help you sleep as well. Okay, my love. But we'll have a look at the results before I decide any of that, if that's all right. Okay. Okay. So, there's definitely something hormonal going on anyway, and we'll see when the results come back. Alright, so what we'll do now is I'll wait for the results to come back, then I will get you to come back and see me. We can go through a treatment plan. Alright, if it does state that your estrogen is low, I will give you some HRT and we can go from there. Alright, my lovely. You're very welcome. It's alright, my lovely. Okay, definitely is something going on with you. And like I said, I do think it's to do with the menopause, but there could be some other things wrong as well. So we'll find out in a couple of days. Alright, and then I can get you back in and we can have a chat and sort out some treatment. But it is very real and what you're feeling is valid. Alright, my lovely. Okay, you're very welcome. Take it easy, alright? And don't be so hard on yourself. Alright, I'll see you soon. You take care now. Bye-bye.